Hi guys! Today we're here because we want to discuss some red flags about autism. So as we all know, autism is a very touchy subject, and us as speech language pathologists are really not allowed to diagnose or discuss this matter. The only person that makes diagnosis on this kind of cases is a psychologist or a neurologist. But I am here to provide you with some tips, some red flags for you to put your mind at ease if you're wondering or if you think maybe, your child might have autism. And it's something that we don't like to discuss very much with parents, so please keep an open mind. And I'm here to give you some tips, and try to be patient with me because I'm super pregnant, as you can see. And my brain is a little bit everywhere. Okay, so what's the first red flag? So when a child does not respond to his name, that is a big red flag for us. As long as you've checked his hearing and we know that he can hear you, when a child doesn't respond to his name, it is one of the big telltale signs of autism. What is another red flag? Some kids start walking on their tippy toes, and that's normal development for children when they start walking, but they should stop walking on their tippy toes after they've been walking for a while. So if your child is already 3.5, 4, and still walking on their tippy toes, that is, a red flag. What else is a red flag for us? So repetitive movements. What do we mean by that? Doing the same thing, over and over again. Like if they rock constantly, arm flapping, if they flap their arms, that is also a very big flag for us. Some kids do get excited and you do want to show your excitement, but arm flapping is usually a telltale sign for autism. One of the largest red flags for kids who have autism is that they don't communicate. So if they have a speech and language delay, they're not verbal, they're not vocal, that's also a big part of autism. When a child has reduced eye contact. So reduced eye contact is also major in communication. You want to be able to engage with the child. You want the child to be able to look at you. You want him to have joint attention. What does that mean? That if we're both doing something, he's looking at what we're doing. He's paying attention at the activity. So kids that have no attention to a project, nothing really, they lack interest, that's usually also something that we should look into. So besides the fact that kids with autism don't speak, at least at first, it's a red flag, of course. With therapy, they will gain the ability to speak, and they'll be, on the right track. So besides the fact that they don't speak in the beginning, they also don't point, and they also have no gestures, and they have no desire to communicate, which is a big difference between a child who's just speech and language delayed and they're trying and they're trying to communicate and they can't, versus a child that might be autistic that doesn't point, doesn't have gestures, doesn't have the desire to communicate. Another red flag for kids with autism is echolalia, which is repeating. So instead of them, you tell them, I want cookie, and they will repeat, I want cookie, but it's not functional, and it becomes echolalic. Echolalic, it is a red flag for kids who are autistic. So these are just some few little things. Some kids flip the light switches on and off, or they have repetitive behaviors such as lining up their toys. They don't like being touched. They don't like to be dirty. They don't smile back. Like if a child with, autism, or you think that he might have autism, doesn't respond back when you smile, when you laugh, like it lacks that gaze of imitating your facial movements, that's also a red flag. So there's a bunch of little things that could be, but in order to be diagnosed with autism, you don't have to have just one of these characteristics that we've discussed. You need to have a whole bunch. It's a whole checklist. It's a whole process. So what would you do if you think that, your child might be at risk? You need to, talk to your pediatrician about it. Then you need to make a neurologist appointment. And then the neurologist will further discuss with you if there's any tests to be done. Sometimes they do EEGs. Sometimes they do, different blood tests. And they will kind of guide you in the right direction once you go to the neurologist. And then, they will send the recommended therapies, which is usually speech therapy, feeding therapy if your child is not eating, or doesn't like certain textures, they might refer to OT. And then, you know, series of other kinds of therapies. If he doesn't behave, if he doesn't follow directions, he might need behavior therapy. It all kind of depends on where you go after you go to the neurologist. But the best thing that you could do is to keep an open mind that, you know, everybody involved wants the best thing for your child. We all want your child to get better. We're not here to discriminate against your child. You know, a lot of parents freak out because they don't want to talk about it and they're in denial about it. But the best thing you can do for your child is to get help as soon as possible. So with that said, if you need anything, you can contact us at Miami Speech Institute. Thanks.